celebrating women in healthcare with Cimas. My name is Miss Red. So today I'm really excited because we are in the dental field of health. Okay, there's a young lady, a young dental surgeon. Her name is Dr. Mungoshi, and she's got such a beautiful story. At 28 years of age, she's doing some phenomenal work, and today so excited to hear her story. So let's go and hear what she has to say about her life. So I always get excited, especially when I get to experience young people in the health fraternity. And this month we are celebrating women in healthcare with Cimas. And Cimas has done pretty well to get themselves a very young contingency of young medical practitioners. So you are doing dentistry. That's amazing. But let's go back to the beginning. Welcome, Dr. Mungoshi. So let's talk about you. Who is you?
So my name is Dr. Mungoshi, or Wazi. People call me Wazi. So I'm a dentist. I'm practicing as a general dentist at Cimas. So I did my dentistry at the University of Zimbabwe, and my high school was at the Dominican convent in Harare. And then post university, that's when I did my internship. I was with the Ministry of Health for a year, so that's a year internship. I did it at the Harare Government Dental Center, which is at Parenyatwa. And then from there, I went into private practice for about 6 months. I was working as an associate dentist. And then I eventually left. Then I moved to Bindura for a year. I was working for a mine clinic in Bindura. And then from there, that's when I moved to Cimas. So Cimas actually gave me a great opportunity to join their company, which is amazing because they have so many young people there, and I feel like it's such a great opportunity for me at such a young age, or relatively young.
Yeah, but it's a vibe, like literally it's a vibe. I've seen a lot of different practitioners within, and I've seen how energetic you all are. But let's just dabble a little bit into your story. What made you want to do medicine?
So when I was 15, I had really bad teeth. Awful teeth, and my mom took me to the orthodontist. That's the story that stuck with me. So she took me to the orthodontist, and the first thing that I saw was his surgery. It was amazing. He has the most the most beautiful surgery in the world, and I was like, wow, you know what? This is what I want to do. I want to do this. This is what I want.
At 15, you were
15, I made up my mind, and I said I want to be an orthodontist, and I never changed. But before that, funny enough, I wanted to be a flight attendant.
Girl.
I know. And then that happened, and then I was like, no, actually, let me do orthodontics. So that's how I sort of like landed in dentistry. So eventually I would want to specialize in orthodontics.
So was there like specific things that you had to do in high school, or like, because I mean, obviously you have the dream, and then do you start thinking, maybe I need to start doing more programs, or it was just in your mind and then you went into it?
So I had to, so from Form 4, so we're at the convent, you do all subjects until Form 4, I think. And then for A level, you now have to decide if you want to go into arts or if you want to go into sciences. So I had to now go into sciences. So I had to do maths, biology, and chemistry. So those are the 3 subjects that I did for A level, because my specific aim was to be admitted into the University of Zimbabwe. And so they tell you have to do MBC or MPC. So I chose MBC because I didn't like physics at all. So that's how I ended up. So that's sort of like how I channeled myself into dentistry.
Channeled yourself into dentistry, I like that. When we talk about challenges that women face, I mean, you're also young, so you fairly have a slight understanding of some of the things that may come up whilst you're trying to pursue your career. Well, what are some of the challenges that you may have faced to get here?
Just being a woman is a challenge itself,
right?
And then you add on being young, and that makes it even worse. So then when people see a young female dentist or doctor,
where's the real
they're like, do you actually know? It's actually the first thing they say is, how are you, sister? When is the doctor coming in? Or how are you, nurse? When is the doctor coming? So it's very challenging to try and then sort of assert yourself and tell your patient, no, I am your practitioner, I am your dentist, I'm who's treating you today. But so I feel like the younger generation is more accepting of younger dentists, but then the older generation is a bit,
so those are some of the challenges that you face.
That's the main thing. Just being a woman itself is just very hard.
So ageism isn't just with the older people, it actually can be with the younger people as well. It can be with
the younger people, but I feel like they're more open-minded than the older people.
Okay. Yeah. So I know we're talking medicine, medics, but in the month of women, I also think it's important to celebrate ourselves and what we do and who we are holistically. So outside of, looking at our teeth, making sure that we are, what do you do to unwind?
I love going to the gym. That's my favorite thing. So every day after work, I'm in the gym weightlifting. I feel like it really helps me de-stress.
Really?
So yeah, there's just so much stress in dentistry. So post work, I like going to the gym, lifting weights. I've also started doing tennis and swimming. Swimming is also great for me, and I love traveling. I mean, money is always a factor, but if I could travel everywhere,
you would just be traveling.
I would just travel every month. So yeah.
Okay. Is there such a thing as a work-life balance?
I think there should be work-life. I mean, practically it's a bit difficult, but
But
in theory, there should be a work-life balance. But then it's also up to you to sort of put that boundary so that you're not taking work home, you're making time for yourself, you're making time to do the things you love. Because if you don't, you sort of lose yourself in your work, you lose yourself in your career. So I really try, especially over the weekend, to sort of detach from my work and just focus on me. So I think it also helps if you actually have a hobby that you like, something that you can actually dive into and immerse yourself into, and then you just forget about your day-to-day work. So I think it's sort of like an individual thing where you decide, you make that decision that I'm going to put myself first, put my social life up front, and then you just sort of separate the two.
You have to separate the two.
You have to separate the two, or else you definitely lose your mind.
Okay. Someone is watching right now and they're thinking, wow, she's so young and she's a whole dental surgeon. What would you tell them? Just a word of advice from woman to woman.
I think be courageous, believe in yourself, be daring. Don't ever think you're underqualified for anything. That's if you have the qualifications, of course.
Yeah.
Just go for what you want. Don't put boundaries for yourself. Apply for anything you want in life. Apply for it. If they say no, they say no. That's the worst that could happen. They say no. But be daring. Apply for everything you want. Everything you feel like you can achieve, go for it.
Wow.
Don't ever put boundaries for yourself. Yeah.
Anything you want, you can have it.
Anything you want. The worst. I always tell myself this.
The worst thing that could happen
is just they say no.
Yeah.
And that's it. And you move on. You apply for the next thing. So don't ever put a boundary for yourself. Yeah.
I'm so inspired. I'm exceptionally inspired. So the theme this time round for Women's Month is Invest in Women, Accelerate Progress. Okay? When you think of that, investing in women, accelerate progress, have you, that mantra, does it mean something to you?
Definitely. I think when you talk about investing in women, you're trying to sort of remove that difference between men and women when it comes to opportunities, when it comes to even equal pay, equal opportunities, equal investment. So I think it's very important to put women, to give sort of like, not a preference, but women are pretty much disadvantaged in everything. So I think when you talk about investing in women, it's putting more effort in making sure that women are seen in these places, in these workplaces, in these positions, so they also inspire other women, other upcoming women, other young women, other young children as well.
All right.
Yeah.
Dr. Mungoshi, we celebrate you, the month of women, the Cimas way, of course. So thank you for what you do, and I really look forward to seeing more of you.
Thank you so much, Samantha.
I had so much fun. I got to sit in this really cool chair and relax and talk to a very young and amazing young lady. Her name is Dr. W Mungoshi, and she's doing some phenomenal work. If you also just want to find out more about what they have and offer in terms of Cimas, their ecosystem, please make sure that you drop a question. But it's always wonderful speaking to wonderful people. So drop something and hopefully we'll give you a wonderful response the Cimas way.